Well, let's talk about that. Maybe some of the reasons that people might be nervous. And I'm not talking about the conspiracy theorists that would be posting somewhere on social media. I'm just talking about a regular person who says, I don't know a lot about science, but I'm wondering, we have Operation Warp Speed. Even the language could cause somebody to be a little nervous to say, well, how do we know that this is going to be safe for me to take? How do I know that? I turn on the television and there are personal injury attorneys saying, if you took such and such diet pill back in the 1990s, then we can help you get a check. How do I know that something bad isn't going to happen to me or my family with the vaccine? What would you say to reassure those people?
Well, here's a great opportunity for Christians to say, let's really look at the truth of the situation and evaluate what the evidence demonstrates for and against the idea that this is something I'd want to take advantage of myself. There's an awful lot of information floating around, particularly in social media, that frankly doesn't represent truth. It represents some certain degree of fear and anxiety and some just frank conspiracies that are pretty outrageous. I guess I come back to Philippians 4, brothers and sisters, whatever is true, whatever is noble, whatever is right, whatever is pure, whatever is lovely, whatever is admirable, if anything is excellent or praiseworthy, think about such things. That would apply really well right here. So whatever is true. And this is where we are making every effort, and I'm very much engaged in this effort, to be as transparent as possible. There will be on December 10th a public meeting to discuss the Pfizer vaccine with all of the details out there about safety and efficacy. A week later, a similar public meeting about the Moderna vaccine. People who really want to see the data, it's all going to be there. And that would be the place to go if you're trying to size up what's the evidence for and against. And again, the Warp Speed name probably was not the greatest choice. It was supposed to inspire people that we're not just, doing this slow and bureaucratic. We're really doing this in an unprecedented timetable, which is true. But it may have also conveyed that we're cutting corners. I want to assure you, as a scientist, as a physician, as a researcher who's been in the middle of all of this since January, we have done nothing to compromise in even the smallest way the safety or the efficacy standards for these vaccines. What we've done is to figure out how to get rid of some of the dead time that normally means it takes 8 years to develop a vaccine, and to do it instead in 10 months. But the rigor involved, if anything, has been escalated to an even higher level than has been applied to vaccines before. In the past, usually a trial for a vaccine was maybe 4,000 or 5,000 people. And these are all at least 30,000 people. So you're really looking for any hint, something that didn't go right. So if the FDA in their conclusions in just a couple of weeks say these are safe and effective, that's because the data says they're safe and effective. So I hope that will be more important in people's view than a lot of the rumors that have been flying around, some of which have unfortunately been made worse by political considerations and timetables that were based on elections as opposed to science. We will not let those things get in the way. This has got to be done right.